What's a big deal about it? I mean, do you think it deserves a day of its own on the calendar?
I would say that it deserves many more days. Whenever you want to show your fondness for a particular person, in the Hindi language they always say, jigar ka tukda. That doctor, can I have an occasional glass of wine or can I have an occasional beer? The answer to that is no. So we all must treat food as medicine, otherwise we'll have to take medicines as food. Weight loss is probably the most difficult thing on this planet. Liver does not forget and forgive.
If the liver had to talk on World Liver Day, what do you think it would be telling us?
If we respect our liver, the liver will return the respect with interest.
So welcome to the program, Dr. Dharmesh sir, and it's a pleasure to have you.
Cheers.
So you've been a hepatologist for a couple of decades, and that's some serious liver loyalty, what you've shown, transforming lives. But if given a choice, will you still choose the same thing, or you've got some secret dream?
Right. So if I have to answer your question frankly, the time when I did my medical schooling, the subjects used to be the so-called conventional subjects. But what one has seen in the last 2 decades is that medicine has evolved in a very different manner than what one would have imagined. Say, I passed from the med school more than 3 decades ago. But things have changed. Nowadays, if you want to look at research opportunities, there are hardly any on the clinical side. So that's why doctors have started to call themselves as clinician scientists now. So they are no longer scientists now. Scientists probably exist only in the domain of laboratories, so biochemistry, molecular biology. So those are the subjects I would have chosen if I were to be given a chance again. Of course, that gives you a different kind of an adrenaline rush. But when a sick patient gets better and walks out of the hospital, that's profoundly humbling and rewarding.
Yeah, absolutely. I second that. And clearly the liver has won, isn't it? So talking about liver, what's a big deal about it? I mean, do you think it deserves a day of its own on the calendar?
I would say that it deserves many more days. Probably, so the human body is divided into various organ systems, and liver is supposed to be the master of the orchestra, and every other organ has to play the way the master wants it to play. So that is the beauty of the liver. It's a metabolic workhorse, performs at least 600 physiologic functions, many of which are so different from what a common man perceives the liver to do. So most of us think of liver as just an organ which helps in digestion of food and an organ which, helps detoxify the bad things that the human metabolism produces. But the liver does so many different things, things that we were not even taught when we were in our fellowship days, It's the largest immune organ in the human body. It is the most important organ that helps you fight against infectious agents. It's the most important organ that decides whether or not you would respond to a given medication in a predictable manner. And I could just go on and on. So I think liver is the organ to go for. So if I had to go back to my clinical training days, I would still choose liver. No doubt about that.
Absolute love for the liver, no doubt. So clearly it's doing all the hard work behind the scenes, though the spotlight on it is probably a little less what it should be getting. So if liver had a personality or a vibe, how would you describe it?
So I don't completely agree to your question. So I'm sure, and we will change the language for a bit. So, whenever you want to show your fondness for a particular person, in the Hindi language, they always say, jigar ka tukda. So commonly, one would think that heart is the one which takes all the accolades, but that's not true. So it's never said hriday ka tukda ya dil ka tukda. It's always jigar ka tukda. So I think it was known, even to someone who made this metaphor, that liver is probably the organ to die for. So I think most of us on the clinical side, no matter what specialty we hail from, we do realize that if this organ is not working well, no matter how good you are at your specialty, probably the patient outcome would not change significantly. So I think more and more clinicians do realize the importance this organ has in the homeostasis in a human being.
So talking about first impressions, could you share some scenes as to how it was when you first learned about hepatology, or how did you develop interest?
the reason or the path for choosing hepatology as the specialty that I wanted to pursue long term was because it integrates probably every specialty of medicine. So if your lungs are good, if your heart is good, if your kidneys are good, then you know that by just correcting the liver function, your patient will have a good outcome. If the other organs are not good, and you need to have a fair amount of knowledge about how the other organs are performing, both in states of health and in distress or stress, and then only you'll be able to reach that conclusion. So I think hepatology, or the study of liver disease, integrates the functioning of all different organs in a manner which no other specialty does. And just to give you an example, when we talk of our extremely end of the spectrum sick patients, in that liver is only a very small component of the severity system scoring. So you give scores to the heart, you give scores to the lungs, you give score to the clotting system, to the kidneys, to the brain, how your gut is functioning with respect to. So all other symptoms, they get integrated as into how your liver is working, and that is how you give these scores. So I think to be a good hepatologist, you need to be a really good internist.
That's really wonderful. So fast forward to now, I mean, watching and studying so many thousands of livers so closely, let's bust some myths. The first one night of wild drinking really shut the liver down. Is it true or false?
Right. So again, it is contextual. So if you have got other risk factors, and then not one night, a few hours of drinking also can shut you down. So now supposing somebody has a fatty liver disease, and that person comes and asks you that, doctor, can I have an occasional glass of wine, or can I have an occasional beer? The answer to that is no. So I think gone are the days when doctors would say that yes, we can endorse some amount of drinking. I know whatever I am saying is not going to change the way people still think and feel about alcohol, but as clinicians, we know that there is no amount of alcohol which is safe.
The bottom line is no alcohol is good for health in any of the ways.
Absolutely.
The next one, we get to hear a lot of organic cleanses for the liver, that black coffee can detox your liver. Is it true or false?
So the organic cleansers for the livers do not exist. So if I have to just sum it up in one line, the liver has got only two friends. One is that you should eat in moderation, and the other is you should exercise regularly. Nothing else is a liver's friend. Now, the relationship between black coffee and liver, it's a coincidence that in the days when we used to struggle with treating patients with chronic hepatitis C, there was a retrospective study which showed that if you take black coffee, and I'll just come in a minute as to how much of black coffee you need, to actually make an impact on liver functioning. So it was shown that those people who used to take black coffee, they had a slightly slower progression of their chronic hepatitis C than those who did not. But mind you, in those studies, it was seen that only those patients or those subjects who used to drink more than 6 cups a day, it would have a real positive impact on the liver health. And that's a lot of coffee. I don't think many people would be drinking that much coffee. The other thing that you commonly get asked is, if I take a lot of green tea, is my liver going to be cleansed? But we must understand that green tea again comes in various shapes and shades. And some of them have actually those chemicals, some of which are alkaloids, which are potentially harmful to the liver. So what I would say is, never go overboard. Just be moderate in your approach to anything. So black coffee is good, but if you are able to enjoy it without having to take other drugs like proton pump inhibitor, then you are able to relish it without milk and sugar. So many people will say black but with sugar. So that takes the effect away.
So it's not like, you can enjoy one glass of red wine in the night and balance it with a black coffee in the morning.
So that probably is not going to happen, but one would have to study that prospectively. I won't be able to answer that question in a scientific manner.
So I'm sure, unknowingly we all kill our liver in some way or the other, apart from alcohol. So what are some sneaky things we unknowingly do that affects our liver health?
So I think the biggest scourge for the human race is caloric intake. So we are all guilty of that, and there has been an explosion of the amount of calories we consume, and it is so obvious that if you look at even 2 generations away from our current generation, you would find that the waistlines were much smaller.
Yeah.
So I think there has been a caloric explosion over the decades, and we are paying a huge price for that. it not only impacts your liver health, but it impacts every single organ in the human body. So that is one thing that I would not say that we are doing it unknowingly, but the problem which I see in my day-to-day interaction with patients is that they would say that, yes, let me enjoy it today, I will make up for it tomorrow. And it becomes increasingly difficult as you pile on, I would not say pounds or kilos, but even grams to get to shed those grams, by way of exercise and curbing your diet on subsequent days. But eat in moderation. I think the portion control is the most important thing. And oftentimes, if we like something, we just get carried away.
Yeah.
And it's got a lot to do with how your mind functions.
So I think that brings up another important topic, and the theme for this year is also food is medicine and you are what you eat. So what is the impact of food that it can have on the liver?
So I think this is gospel truth of sorts. So we all must treat food as medicine, otherwise we'll have to take medicines as food. So this is something that we should all be aware of, and like we have discussed in this conversation, that most of the problems arise from being indiscriminate in our choices of food or in the amount that we wish to eat. Liver is the organ which is going to handle what you are feeding it. So the good, the bad, the ugly, liver will have its own ways of, sending it down the regular metabolic pathways which are physiologic. Then it will have some other collateral pathways which it will invoke, which will lead to a lot of stressful situations.
I think, moderation is the key. So let me flip the question. So what are some liver-friendly habits that you think we all could follow?
Eat whatever you wish to eat, but portion control and exercise regularly. So we should all know that liver is the largest storage organ in the human body. So this is an example which I give very commonly to my patients. So supposing you are having a caloric excess, so the body very quickly converts it into fat, because fat occupies the least amount of space, and then it will probably try to store it at a place where it finds a lot of room, and that happens to be the poor liver. So that is why this common occurrence of fatty liver in people, who consume more calories. So it's not just diet specific. You could also be consuming more carbohydrates. They will get converted to fat and they will be stored there. So the body or the human being is trying to follow the law of nature, which is to conserve its entropy and enthalpy. That is the basis of human existence, and for that matter, any living being's existence. But in that process, it's the liver which gets damaged. And this is a question that is very commonly asked by patients, that if I have some cheat days, how do I make for it? So if you have to make up for it, it has to happen in a matter of days. It should not be, okay, this week I am only 0.5 kilos up, next week I'll try to get it down. That's very difficult to achieve. You will find that the amount of calories between the age 20 to 60 that we have consumed on a daily basis to have accounted for that expanded waistline and many more kilos that we see would only be equivalent to one potato chip. So I always say this, that weight loss is probably the most difficult thing on this planet. And the only way to overcome that is not to allow it to happen.
I think that's really an eye-opener. So talking about cheat days, do you think liver can forgive and forget, or does it hold on the grudge?
Liver does not forget and forgive. That is the
really
saddest part of the story. So this is a brutally honest organ, also very mathematical when it comes to how it handles the stress we give it to. So of course this is the only solid organ in the human beings which regenerates. So again, that is a statement that has to be very nuanced. Oftentimes we say, oh, this is an organ, if I insult it also, in any case we are going to have no new liver cells which are going to form. That's not the whole truth, because it will all depend on how good your liver was when you insulted it. And oftentimes it might not be pristine when you insulted it. It's not an organ that forgives and forgets.
If the liver had to talk on World Liver Day, what do you think it would be telling us?
Liver would definitely say, handle me with more respect. So I think this is one organ which has to face the brunt of a number of things that go on with the human physiology. But a lot of rubbish that we give the liver is kind of, extra burden that we put on it. And that is why at times it decides to misbehave. So mind you, there is a huge underpinning of genetics as to how the liver works. And in recent years, we have started to elucidate those pathways. And that's why no two human beings who might be having a similar kind of a lifestyle, stay under the same roof, eat similar kind of food, they would respond in a similar manner to a given insult. So I think there is a lot there is still to know about how the liver functions. But the important thing is if we respect our liver, the liver will return the respect with interest.
That's well said, Dr. Dharmesh Kapoor. So I can totally picture that. So if there is one message that you would like to put it up on a billboard on the World Liver Day, what would that be?
I am your friend. Treat me like one.
So finally, is there any message that you would like to share with our viewers out there to spread awareness about liver health on this special day?
So the important thing is that the two things that we see in our day-to-day practice, which are actually adversely affecting our liver health, is the caloric explosion in alcohol. So I think these are the two things that this message must go out loud and clear, that there aren't going to be too many chances that one would get as an individual, to rectify things. And other thing which is for which many of our colleagues in our fraternity are responsible is that we burden ourselves with too many pills. So again, that is something, and of course it's going to take time for these practices to change, but again, anything that you take has to go down the liver path. That's something that we should remember. And if we are calling upon the liver to do its duty every now and then, there would be a time when it would say that, no, I need to shut my shop. And that there will be a very heavy price to pay if the liver does that.
So thank you, Doctor. It was a pleasure interacting with you, and it was an insightful discussion as well.
Cheers.